everyone. I'm Michelle Jimenez, and I'm a social science researcher at the Stanford Department of Emergency Medicine. In this video, we will explore how to access healthcare during the COVID-19 pandemic. I am joined by Dr. Sindhya Rajiv, who is an emergency physician at Stanford University. Welcome, Dr. Rajiv.
Hello, I'm excited to join you today to discuss how we can still access healthcare during the pandemic.
Before we get started, we have some important disclaimers. While we will talk a lot about healthcare, this video series should not be used for personal medical advice. If you're worried about your own health, please talk to your doctor who knows you and your medical needs best. We may also talk about legal issues that have come up during the pandemic. Our aim will be to make you aware of these, but once again, you should talk to a lawyer if you have any legal concerns of your own.
And finally, we have no financial conflicts of interest to declare.
In this video, we will go over what to expect when accessing healthcare in person during the pandemic, what clinic or emergency department visits can look like, and how visitor policies may affect you.
Before we continue this discussion, we want to reassure you about two things that are still the same. First, in-person healthcare is still available. And second, it is safe to go to the emergency department or your doctor's clinic. Healthcare providers are all taking precautions to make sure you don't get sick while at the hospital or visiting your doctor. Unfortunately, some patients have waited too long to see a doctor out of fear of catching COVID-19 in the hospital or clinic. This has led to some unnecessary complications and even deaths.
So, what if I need to see a doctor about something? How do I make an appointment?
Before making an appointment, someone from your doctor's office might want to talk to you first about how you're feeling. This might be done through email, secure messaging, or over the phone. They will ask you about your symptoms and if you've had contact with anyone who has tested positive for COVID-19. They will then decide whether you will be seen for a telehealth visit, if you should come see a provider in person, or if you need to go to the emergency department. Most likely, if you're mildly sick, need prescriptions refilled, or require an annual checkup, you will be scheduled for a telehealth visit with your provider. To keep both patients and healthcare staff safe, many doctors' appointments are now held through telehealth. This means that you might be talking to your healthcare provider from your own home on your computer or smartphone.
For this video, let's talk about what happens if I really need to see someone in person. For example, if I have a cut that needs to be stitched up, what can I expect if I go to a clinic or hospital?
We mentioned at the beginning that it's safe to go see a doctor. This is true. Most clinics and hospitals have set up strict protection measures because of COVID-19. When you first arrive at the hospital or the clinic, you may see stickers on the ground marking where to stand, or even tape that marks walking routes to follow that are designed to keep you safe and healthy.
I've seen similar stickers when waiting in line to get into the grocery store.
Exactly. Hospitals and clinics make sure all patients are kept at least 6 feet apart. The stickers on the floor are one way of ensuring this. To make sure that people maintain social distancing, certain chairs in the waiting room are marked safe to sit in, while others are blocked off and not to be used.
What else can we expect to be different?
Someone will likely meet you at the door to check your temperature and ask about COVID-19 symptoms. You will be offered a new mask when you get there, and you can depend on everything being extra clean.
What about visitors? If my mom is sick, am I allowed to go with her?
Some hospitals and clinics will not allow any visitors, while others allow one visitor to come inside with the patient. It's helpful to call in advance to ask about their policy so you can decide who you want to bring. The visitor policy may change over time as COVID-19 cases increase and decrease. For example, where I work at one time, we allowed one visitor, but as the number of COVID-19 cases rose, no visitors were allowed, and now we allow one visitor again. The exception here is if you are the patient and you bring your children with you. Your children can all stay with you at the appointment, but of course, like everyone, they will need to wear masks the whole time.
What if my child needs medical care? If a place only allows one visitor, does that mean only one adult can accompany my child into the appointment or hospital room?
Yes, we know this might be hard, so it's something to plan for in advance. Also, if you're unable to go into the facility with a family member, make sure the patient has their medication list, your contact information, and their preferred language written down on a piece of paper.
What can someone do if English is not their preferred language?
There are a few options that clinics and hospitals might use for patients who don't feel comfortable speaking English, or for people who prefer not to for any reason. The first option is an in-person medical interpreter, whose job is to interpret for patients at some hospitals and clinics. In this case, a healthcare provider will call for an interpreter in the patient's preferred language, who will then join you during your appointment. They are trained for these roles and are held to the same laws of confidentiality as your doctor. Even better, they are experienced with translating medical terminology and can help make sure you get the answers to the questions you have. The second possibility is a phone interpreter if no in-person interpreter is available. Someone at the hospital or clinic will probably call a phone interpretation service. They may put an interpreter on the line and have the phone on speaker in the room or in line with your video call. That way, you and your doctor can both hear. This is also an option for a telehealth appointment. You should be prepared for the visit to take longer to allow time for translation.
It is very important that you know you should never have to depend on a family member or friend to translate for you. It is your choice who you bring in the room with you. Ideally, the clinic or hospital will get a translator without you asking. But if for some reason that doesn't happen, it is your right to ask for a professional interpreter.
This is especially important for two reasons. One, these interpreters are trained in medical terminology. No matter how fluent someone is in a language, medicine is a language in itself. Every patient deserves to get healthcare in the language they are most comfortable with. And two, it's important for us to hear a patient's specific words. We know family members are often close with the patient, and so they might speak for them because they know what's going on. But hearing from the patient themselves can be really helpful to us when we're figuring out someone's health concerns. So it is always okay to ask the clinic or hospital to get you a trained medical interpreter, and we encourage you to do so.
So let's review what we learned in this video. First, before going into the clinic to see a provider, I may need to speak to a healthcare provider to determine if I should schedule a telehealth or in-person clinic visit or go to the emergency department. When I get to the clinic or hospital, for everyone's safety, I will be offered a mask and guided to keep at least 6 feet apart from others. Finally, I should check the clinic or hospital's latest visitor policy as I will need to make plans on how to advocate for family members and arrange for childcare. Anything else to add, Dr. Rajiv?
Yes, if you need medical help, you should go to the doctor. Healthcare is still available and it is safe.
Thank you, Dr. Rajiv, for joining us for this conversation. And thank you to all of you for joining us and learning about in person care during the pandemic. We hope you learned some valuable information, and we will see you in the next video.